The first signs of breast cancer appear with a large tumor. Early cancer is detected only at the examination. The ideal interval between examinations is 6 months, because within a year the cancer can move to another stage. The structure of the mammary glands and the development of cancer. The mammary gland consists of tiny ducts with complexes of cells at the end. Several microscopic structures form a larger lobule. 3 dozen lobules make up the lobe with the duct going to the nipple. 15 lobes are the mammary gland, and their number and location are individual. Between the lobules is placed adipose tissue, which are held together by connective tissue ties, stretching from a dense capsule, which wraps the gland on all sides. The whole breast is permeated with lymphatic vessels, which carry lymph to the axillary lymph nodes. The function of the mammary gland is to produce milk for feeding. The end of the reproductive period leads to its involution, a decrease in the volume of glandular tissue in favor of fatty tissue. Symptoms and first signs of breast cancer. Early breast cancer is most often detected during examination, ultrasound, mammography or MRI, because it does not give any symptoms. One sign is the presence of a neoplasm. Detectable to the touch tumor, at least corresponds to stage 2. Cancer up to 1 cm is palpable only in the aged breast with almost complete absence of glandular parenchyma. Benign nodules in the gland and the initial cancer are little visible. Carcinomas are denser and not smooth to the touch. The borders are not as clear as those formed by the capsule of fibroadenomas or cysts. As the neoplasm grows, the breast changes, losing its symmetrical shape. Normally, most women have a slightly larger left breast, but both are symmetrical. Deformity of the breast with retraction or bulging indicates the presence of a tumor. In a healthy gland, the nipple is cylindrical, evenly elevated above the areola, without being fixed to the skin by one side. In cancer, it is deformed and fixed. A typical sign is changes in the skin above the tumor. This can be a dense and not smoothing fold, a lemon crust or ulceration, a long-lasting painless reddening with thick skin, muscles, and lymph drainage are involved. Benign mastopathy, on the other hand, causes a bouquet of symptoms during certain periods of the menstrual cycle. Thickening and enlargement of the breast lobe with swelling and reddening of the skin is characteristic of infiltrative carcinoma. This form of the disease is accompanied by pain, especially severe with metastatic lesion of lymph nodes with the formation of a conglomerate squeezing vessels and nerves. Comparison of similar symptoms with other breast diseases. In the breast, dyshormonal diseases can coexist with a malignant process, because all pathological changes in the glandular parenchyma have a common beginning, the proliferation of glandular cells under the influence of inadequate production of sex hormones or perverse sensitivity to them. The ultrasound, mammography, and best of all, MRI can distinguish cancer from a benign process. Mammography is not always able to visualize pathology in dense, full breasts, while ultrasound in young, hormonally active women is more sensitive and precise. Mastopathy causes discomfort and pain, but these symptoms are inconstant and associated with fluctuations in the levels of sex hormones in the blood. More often there is diffuse thickening, but also local, focal, which differs from carcinomas by alternation of dense areas with smooth small cysts or thrusts. Tissue density is close to normal, and the MRI scan looks like a normal parenchyma with cysts and connective tissue nodules. Fibroadenoma of the breast does not hurt, feels softer, has smooth walls, and is clearly limited from the rest of the parenchyma. Cysts are asymptomatic, characterized by a fairly rapid increase, dense, but elastic, with a smooth surface. The X-ray examination shows a thick capsule and fluid. Early stage breast cancer. How to diagnose and treat early cancer is stage 0 in situ and stage 1 is curable in 95% of women. At stage 0, the tumor is found only by microscopic examination of a suspicious lump in the breast. At stage 1, in a small gland you can palpate a node of no more than 2 centimeters. Lymph nodes are not enlarged, but in stage 1B, a sentinel lymph node biopsy during surgery finds clusters of cancer cells less than 2 mm in diameter.